Hi everyone, welcome to this fortnightly Tools for Frontline Staff session. We've got a presentation today from Aretha, who's here from Health Spot City in Hackney, and is going to be talking about the Super Youth Hub project. And I'm going to pass over to Aretha, so please take it away.
Hi everybody, my name is Aretha Agri and I'm from CAMS Alliance Project Group, which has the Super Youth Hub project underpinned underneath, which has also Health Spot City in Hackney. And today's presentation will be a brief overview about Super Youth Hub project and Health Spot City in Hackney. Next slide, please. So about the Super Youth Hub project, this was the Super Youth Hub project came about from the responses of young people within City and Hackney saying they wanted a service tailored around that supports their needs rather than services just having a service out there. So they wanted services to support their needs, and the voices of young people was explored through an action research that the team did beforehand, before the project was underpinned. So the three strands of the project is streamlining access to services for young people, hence why we have Health Spot City in Hackney, which I'll tell you about. Also improving awareness and understanding of support available. So we have a health and well-being influencer that supports us with making sure that young people within City and Hackney know about the service, what's on offer to them, and ensuring efficient coordination and enabling system change. And that is basically working with partners and the voluntary sector around supporting young people in ensuring that their health and well-being support is basically coordinated throughout the whole borough. Next slide. So this is some of the co-production work that's taken place within Health Spot City in Hackney. So we've got a young advisor that supports us in getting the voices of young people heard throughout City in Hackney. We had a participation action group where there were 16 young researchers that went out across City in Hackney speaking to young people about what type of services they would like to see. We've got the System Influencers program that participated in 3 cycles, and this was done in collaboration with Health Watch, and they supported us on different strands of this project. So for example, the last cycle, they supported us with putting on a sports event to support young people in using physical activities to promote Health Spot City in Hackney, and also get to basically get more information on how to support their emotional well-being. We also have the youth steering board that feeds into basically any projects that we're working on within Health Spot City in Hackney. And then we have the health and wellbeing influencer that supports with videos that go out on a monthly basis on promoting Health Spot. So here to talk about Health Spot City in Hackney. So Health Spot is basically a integrated health service for young people aged between 11 to 25 to get support with their health and wellbeing support, and from anything from guidance, support or information. So it's located in the Forest Road Youth Hub in Dalston, and young people are able to get access from a GP, sexual health nurse, youth workers, counsellors and mental health practitioners that support with emotional well-being, employment advice and drugs and alcohol. We launched back in September, but these are the figures from September to December. So we've had 45 young people do online bookings. We've had 182 one-to-one appointments at Health Spot. And then we've had 409 plus contacts with young people in group work sessions at Health Spot. And then 300 plus contacts with young people, parents and carers through Health Spot outreach teams. So what we do, we go out into the community to promote Health Spot to young people by speaking to them outside leisure centres, schools, colleges. And sometimes we come across parents to let them know that, look, this is a service that their young people can access. And 479 plus young people reach through presentation events and other outreach, such as like school assemblies and stuff like that. So it's pretty easy for young people to access an appointment through HealthSpot. So what they can do, first of all, is walk into the Forest Road Youth Hub, where they'll be met by a youth worker, and just speak to that youth worker and say, look, I'm looking to get support in this following area. And the youth worker would either make an appointment for them, or if that appointment is if that service is delivering something on that day, the young person's able to, for example, see the sexual health nurse on that day. Or they can go online through the Young Hackney website /HealthSpot and request an appointment by using the appointment booking form on the website, or a professional or teacher, a parent can make that appointment on the young person's behalf. So this is some of the teams. This is the delivery team of HealthSpot. So we've got Dr. Neha, we've got the therapeutic youth workers, we've got the employment, Reshma, who does employment, and the sexual health nurse. Go to the next slide. Because HealthSpot is delivered outside from the Forest Road Youth Hub, this is in conjunction to Young Hackney. So the Forest Road Youth Hub has a senior session that young people, if they come for an appointment, they could also access the youth hub and speak to youth workers. And yeah. Next up. And then this is the GP service, where young people can basically access any health related needs that they need. So like down to period, concerns about their weight, feeling low in mood and stuff like that. At the moment, the GP service is only open to young people from the London Fields practice. So that's the following what's on the screen. So Beechwood, Dalston practice, London Fields, Queensbridge Group, Richmond Road Medical Centre, and Sandringham practice. We're looking to explore it to other GP settings, but at the moment it's just restricted to young people that are registered to the London Fields practice. Then we have the sexual health nurse, which is based every Tuesday. This is quite a service so far. From Tuesday on a Tuesday, 3 to 7 p.m. Young people are able to walk into this service as well and see the sexual nurse. And then we have employment support from Connecting Futures and Mind in the City and Hackney support us in delivering this for young people. So they'll support young people with employment, well-being, give them one-to-one coaching and advice, and engage in stress and mindfulness activities. And then we also have Family Action that offer one-to-one group sessions with young people. They have a creative youth art counsellor and also a therapeutic youth workers that offer sessions to young people. They also do group work with young people as well. And we also have Growing Minds that are part of Family Action that support young people from the Black and mixed race heritage as well, offering that emotional wellbeing support. And then on a Friday, we have a smoke-free service that supports young people with trying to stop smoking and putting in some support plans with young people in trying to reduce their intake in smoking. On a fortnightly basis, every Monday we have a health and wellbeing drop-in, which is for young people to come and speak to the health and wellbeing therapeutic youth workers around anything around condom distribution, emotional wellbeing. So these are specific topics that will be run on a weekly basis which is embedded into the senior session at Forest Road Youth Hub. And then we also have the substance misuse that is there on a Friday and on a monthly basis. And this is an opportunity for young people to speak to the substance misuse worker around any substances that they may be worried about taking, or if they're concerned about a friend taking substances, and get general advice and support. Yeah. So part of a lot of the work that I've described is in conjunction with the voluntary sector and other organisations. So with the health and wellbeing influencer, that support comes from Mouth at Roars, which is a media charity, Family Action, that is that support us with the therapeutic emotional wellbeing support. So we want to work with the voluntary sector in making sure that we are offering a holistic health and wellbeing service to young people around City and Hackney. So our partnership working, our goals are to strengthen collaboration with the voluntary sector. Also, at the moment, I'm involved in a piece of work where I'm mapping out existing health and wellbeing, the health and wellbeing offer within City and Hackney across the voluntary sector, identifying gaps, any challenges, and the best way how we can all work in partnership in coming up with a solution to reduce these gaps and challenges, and basically just keeping open communication with everyone to strengthen our partnership. If you'd like to find out more about HealthSpot City in Hackney, please do email me. My email is in the chat, or you could just, once the presentation is sent forward to you guys, you can get just email me. Thank you. Any questions?
Charlie, do you want to come in?
Yep.
Hi, Aretha. Great presentation.
Thank you.
We had a presentation a few months ago from an organisation called Couth.
Oh, yeah.
I was wondering if you knew them and how you work together.
Yeah, so Couth are the online system. Is online
mental health offer.
Yes, so they deliver us training and stuff like that. We haven't got good partnership at the moment with, not, I shouldn't say good, but we haven't worked with them as yet, but that's something that we'll probably need to explore more.
If it's helpful, we can pass on our contact details for the person who presented here, I think in January or December.
Was it Cleo?
Yeah, it was Cleo.
Yeah.
Yeah. Cool.
Thanks, Charlie. And yeah, thanks, Aretha. Great presentation. There's loads of different things as part of that program, so it must be quite a lot of work to coordinate and manage. Does anyone else? I've got a question, but does anyone else want to come in at this point? I was going to ask around all those different sort of healthcare professionals that are involved in delivering the actual support. If one of the young people came to them and asked about something non-medical, so let's say if it was sort of cost of living related, poverty related, housing, that sort of anything else, basically, do those professionals, do you think, are they like equipped with where to signpost people to? Would they go to a social prescriber? Like, where do you think they would go?
They'll probably go to the social prescriber.
Yeah.
However, just answering your question, this is what we want to make stronger.
Yeah.
So we want to be able to say, right, we know of these organizations that can support with that. So this is the idea of us strengthening our partnership working. And for me to actually, my role is to able to give back the information to the providers and say, right, we've got these different organizations. So if a young person came with, oh, I'm just being made homeless, you can send them to that organization. So that is something that we're really, really working on.
Yeah. Just before I come to you, Jenny, and are there obvious gaps at the moment that you really want to fill? Are there things that you think, I just don't know where to advise them to send people to? Like, where could we help, I guess?
I mean, I could probably come back to you with that in terms of,
sure. Cool. Yeah, if you get in touch with me and Charlie and Jenny and the other people in my team, I can give you the emails. Then between us, we should be able to put you in some useful directions. Jenny.
Yeah, I was just going to say, get the providers to come here as well, Aretha, and cut out them. I mean, it's great that you can surface what they are coming up against, but we find it works so well if those who are working directly with the resident connects in with this session, because then if they've realised that, if they've had 5 young people that week asking for a particular thing that's a gap, then this group often have quite good solutions that they can get them to find. So if you were to encourage the providers, even if they just had one person going from their organisation or watching the video, getting plugged into these, it's not even just about the information, it's the relationships they can build when they're in this space. And there's so much knowledge and expertise on the call, not just those that are present now, but it goes out to such a broad range of people, that if they're on the call and they're talking about what's cropping up, there may be people that can help them. So we definitely encourage them to come along. And we find that, if we encourage people to come along once they've actually been here and go, it's useful. So those providers, it'd be brilliant. And we don't have enough health people coming. We'd love to have more health people. And I think that part of that is because all of our branding says Hackney Council, and I think there's enough invites about health stuff that health colleagues, But when we do have colleagues from the health sector come and present here or connect in with the network, they get so much out of it, especially if they're trying to support somebody with their holistic needs and they really are trying to do that. That's I guess that's the point. It's like the idea that this is the team behind you. You might be out there with the young person, but then there's a whole lot of people behind you that can help.
Exactly. And useful information. So
Thanks, Jenny. And if you want me to invite people, just send me their emails and I can add them to this. And even if they're just getting a newsletter, even if this time doesn't work for them, they'll still get all the information as well. Rachel.
Hi, yes, I'm actually, my name's Rachel and I work with Hackney Lunch Clubs Network. So I actually work with older people. So I'm actually asking this question because I live in Hackney and I've got a friend who lives in a very small flat with her teenage son. And I understand that it's not always been easy. And it makes me think about how the young people learn about what's on offer and how are they eligible for your services, because I often wonder about him and how he's managing living in such a small flat with his mum, who's always quite stressed and depressed. She's my friend. And I wonder if, like some of these services are talked about in schools, and if that's how young people would access. Because I'm often thinking about this family and what I might be able to kind of suggest or offer to them.
So a lot of it is word of mouth. I do go into schools and speak to young people through school assemblies and tutor groups. We also rely on the health and wellbeing, Young Hackney Wealth and Wellbeing. They support us in getting the message across to young people in schools as well. We're part of the outreach team where we speak to the young people in the local community. I find that works really well. I mean, this particular young person, if I can send you my the flyer and stuff like that, and they can literally if they feel like they could benefit from this support, they can literally go through the Young Hackney Health Spot webpage.
I mean, actually, I could share that with him. He trusts me well, so, and I don't think, he might not take it up. It's up to him. He's 17. But I just kind of wasn't sure if you're particularly targeting, or is every young person
that lives in the city in Hackney, and
would be able to kind of reach out for support.
The only restriction is the GP because of the different because of the practice that the young person belongs to. But in terms of emotional wellbeing support,
it would be emotional wellbeing support. It would be that.
And also accessing the youth club, the Forest Road Youth Club as well. It's there Monday to Friday, in the evenings, and they do a different variety of activities. And just having that respite from maybe the home could be useful.
I know the Forest Road youth. I know it.
So I can send you.
I think he's not likely to join that. He's got friends and everything. It's more the emotional support, I think, for him. Thank you for that.
That's all right.
Thanks, Rachel. Charlie, do you want to come in?
Hi, another question from me. I know, so your part is based around the London Fields PCN, isn't it? This work. Do you have, I know that the Richmond Road Health Hub is like a really well attended forum across multiple, I know it's only takes to adults. Do you ever go there? I think
I've been to one. I have been to one.
It'd be quite a good place to capture quite a lot of people. I don't know.
So our GP is actually from the Richmond Road practice.
Okay.
So yeah, we work closely with Richmond Road.
Thanks, Charlie. Jenny?
Yeah, I guess I was curious, Aretha, on what would be most helpful. I think it's brilliant that you're here to kind of open up that dialogue and to maybe keep coming back to this group as well. But is there anything that this group can help with in terms of insight, information that's useful to you? Because I think the more we sort of know where the challenges are or what's kind of most difficult for you guys at the moment, the more we can all be thinking about how we can be helpful.
So I think to answer that question, at the moment we're completing this mapping exercise and looking at the gaps and challenges. But for me, I was just listening to what you were saying about signposting young people in terms, because we are looking at health and well-being offer, but that is also going to include holistically around the cost of living, poverty and stuff like that. So basically just knowing what type of information's out there.
Mm-hmm.
We're getting to know the information in terms of health and well-being offer, but it's also knowing what else is out there in terms of like supporting young people financially. I know we do have an employment support, but if there's any organizations that support with that, and yeah, just I guess knowing more what organizations do.
Yeah. I think Charlie's going to come in because Charlie's got Charlie and Hannah and lots of those in our team have got quite a lot of insight in that they'd, I'm sure, be willing to work with you to sort of connect people up. But also this room, the more we know what young people are saying to the providers, the more this group will have ideas for sure.
Okay.
Because I think everyone's sort of plugged into lots of different bits of the system. So yeah, if you, whether it's you that surfaces it in a couple of months' time and comes back, these are the themes, these seem to be the gaps, then we may well be able to sort of help you as a collective group. But in the meantime, Charlie and Chanel are going to come in.
Aretha, absolutely happy to chat. I've got quite a lot of, so in my role, I've done quite a lot of mapping about what's out there in the borough already.
Okay,
and
cool.
what I'd say with the mapping as well is that because we're so lucky in Hackney to have such a vibrant voluntary sector that's doing so much, it changes so quickly as well. So organizations might run things for like a week or two or a couple of weeks, and then it changes again. So the best thing to like find out what's going on is just to make the relationships, because then the partners tell you what they've got on and stuff. But I can definitely if we find some time together, I can kind of show you in that PCN who might be worth talking to or nearby, and introduce you to them directly, so then they can tell you what they've got on, because they know best, really.
Okay, cool. Thank you for that, Charles.
Thanks, Charlie. Chanel, do you want to come in? Do you want to introduce yourself as well?
Yeah, hi everyone. I'm Chanel. Literally started just this Monday with the strategic team working around poverty reduction. So I'll be working really to support the household support fund. So just in regards to the employment support, I wondered, does that offer any financial education as well to the young people? Because one of the things that we find with issues around poverty is that it can be quite multi-layered. And so one of the things economically can be around finances, understanding finances. If students are going off to uni, that's one of the biggest and the first loan that they will ever have. You know, working, if they are going into employment, also knowing how to manage their money.
I'm not sure if it does actually if the support comes with that, but I can double check and get back with you. I know it's more on looking for employment, CV building and stuff like that, but I know the Youth Hub do sessions around financial independence and stuff like that.
Okay, thank you.
Thanks, Chanel. Thanks, Aretha. Does anyone else have any other questions for Aretha while we have her here? No? Okay, Chanel, I think, is that have you still got your hand up, or is that okay? Cool. Thank you so much for coming, Aretha. That was really, really helpful, and hopefully we can sort of continue this conversation and definitely help you with the mapping exercise. So do get in touch with me and Charlie and Jenny and the rest of the team. And yeah, like Jenny said, keep coming back to these meetings, because yeah, there should be lots of people who you can support with that.
Okay, cool. Thank you. I can stay for the meeting now, actually. Oh.
Great. Oh, awesome. Cool. Right. I think, am I going to pass over to you, Jenny?
Great. Yes,
yeah,
cool. I'm hoping I can use some of the time. But before, that was such a brilliant presentation, Aretha. And just to say, that piece of work I was aware of since the inception of it with the consultation with young people. So it's amazing to see it finally coming together, but also just know how challenging it can be, these kinds of initiatives where you're trying to coordinate multiple services. So do draw on this resource, but also those in our team to help you, because we've done quite a lot of work in those areas before. Also great to see that the System Influencers program is still running, which is something that I led the co-design of in my last job, that program, the System Influencers, which is the young people coming in to help really change health and social care services based on, whilst also getting really great work experience. So that's a really great example of an intervention also in Hackney that is doing multiple things to support young people's development in terms of influencing, sort of getting in a place where they can kind of influence system change, but also building their confidence and resilience and employability that way. So it's brilliant to see that how you've used those roles within this program as well to really make sure it sort of speaks to the voice of young people. So that's amazing. So I wanted to, before I actually get into what I wanted to talk with you about, I did wonder whether Rachel King might like to come in and speak very briefly, introduce herself and speak very briefly about lunch clubs. I know that Rachel, I might be putting you on the spot here, and you may not, but I encouraged Rachel. We were at a session together as part of the to do with the voluntary sector grants redesign process, and Rachel was there, and I was raving about this session, as I always do in these meetings, trying to tell people that they must come because it's really useful. And yes, you know, really busy, but you come. There's lots of people here. So anyway, I just wondered whether you wanted to put out a bit of a shout, Rachel, because I know that the lunch clubs are really going through some challenging times at the moment and provide such vital holistic services to residents in Hackney. So yeah, just wondered if you wanted to come in first, and then I can do my bit.
Thank you, Jenny. I'm happy to. I mean, I'm aware that sometimes I'm a bit all over the place, but I will, while I'm here, I might as well introduce myself and explain who I am. I actually don't work on Thursdays, so I'm in my kitchen, but I'm really keen to join these kind of meetings. So I often end up doing quite a bit of work on a Thursday, but it's not one of my official working days. I work Monday, Tuesday, Wednesday. I'm based at Hackney CBS. I'm also a resident of Hackney, and I have a job basically which is called Hackney Lunch Clubs Development Coordinator. I've been doing for 3 years. And I work with a network of lunch clubs for people aged 55 plus across Hackney. It's not all the lunch clubs that exist in Hackney. There's actually quite a few more than those that are in this network. But my job is specifically to support those lunch clubs that have been actually funded through Hackney Council for quite a few years. But actually the contract that I was working on is one that was funded through adult social care for about 5 years from 2018. And we're currently in quite a challenging period because we have basically 10 months of funding left, which is currently being funded through the policy and strategy team at Hackney Council. But I'm aware that the money is still coming from adult social care. But yeah, we've been very aware that funds are very tight. I guess the challenge for us is that the network of clubs is really an amazing network of clubs, and they've been going since the 70s and the 80s, and some of them are much smaller, some of them belong to organizations, some of them are standalone lunch clubs, but I would say that they all in their own different ways provide a really, really important service to the people that attend, and have got a lot of potential to do more even. I've been working a lot on how can we collaborate with different people? How can we bring in other things into the clubs and support those people that are in clubs? How can we reach out to more vulnerable people that don't know about the clubs that would benefit from being there? But I have to be honest, a lot of my time is spent defending their existence and trying to find ways to support them financially. I am not a fundraiser. I wish I was. I have done fundraising in my past in other jobs, but it's not what I have been hired to do here. Anyway, so I am, I just really was interested in this group, and I will probably attend regularly, even though it's not on a particular working day, because I really, apart from it being my job, I live in Hackney. I observe what's going on around me. I live in a housing estate. I see what happens to my neighbours. And I believe this is a time for us to support how we eat and how we meet and how older people are supported and we carry on supporting them through this kind of way, even if we're under crisis through funding. So I've got my own kind of like real belief that bringing people together, cooking together, it actually doesn't really cost that much money, and it's got such great benefit. Are there other ways that we can work together my mind's constantly thinking about how can we work together, and if there are some clubs that need improving on, or they're not doing as well as they could be, how do we reach out to other people that want to come in and help them? I can't unfortunately do it all. I'm a very open person, and I'm just exploring. I mean, we have, for example, sometimes I think it's kind of like building relationships. So there's a woman in Homerton Hospital that was doing kind of bowel cancer awareness, and it's worked really well to kind of introduce her to the clubs, and she's done some really useful sessions. And one of the club members recently said to me, they really wanted someone to come and talk to them about diabetes from the diabetes. So I'm reaching out to Homerton again to get someone to come in. So it's about like giving them support. I know that finances are really tight, and in fact one of our clubs has recently seen that younger people have been attending. The East and Southeast Asian Community Centre Lunch Club has become quite popular with younger people, because it's kind of like, it's a groovy older people's lunch club. So the younger community of like Chinese, Vietnamese are finding it interesting to go there. And that's been a bit of a challenge for the club, because it's actually 4 elders. But in a way, the elders are really appreciating having younger people. So the club is basically putting the prices up for younger people and reducing the prices for the older people. So instead of £5 for lunch, it's now £3 for those 55 plus. And the younger ones who can afford it are now paying. So they are navigating. I think that's actually quite a good way of managing that. So, each club will manage things differently. Obviously, the funding is for the older people, but if there's a club that is, in fact, in that particular community, I've heard some of the Chinese elders there going, because they're seeing this younger generation coming through. A couple of them have said, they're now feeling like it's kind of trend. It's cool to be Chinese, right? Because they often, I think, from their generation, they've experienced a lot of not nice treatment, and people have been abusive towards them because of their heritage, and they're seeing, and they've felt different feelings about what it means for them to be Chinese, and they're actually seeing this younger generation, and it's giving them a different awareness. So happy to be contacted. I'm based in Hackney CBS. I work 3 days a week, like I said, and really keen to, Charles knows me quite well. We're often like thinking about ways of you know, how do we reach out to people? How do we work more with social prescribers? How do we work more with GPs? How do we work more with the social workers within the council? But again, like, it's quite challenging for me to do. The one final thing I wanted to say was, it's sometimes I get feedback from people that say, oh, I've been trying to contact a lunch club more by email, right? I'm trying to reach out. I'd like to go and do something with them, or I'd like them to share some information about older people. And I just know that most of the people I'm working with in those clubs are rushing around, kind of managing the intake of, you know, people arriving, making sure that their food is being cooked. Answering emails is not the thing that is necessarily easiest for lunch club coordinators. And a lot of them most of them are paid not very well, or are doing a lot on a voluntary basis, or doing it completely on a voluntary basis. So the income and the funding side of things is, yeah, it was a kind of a shock to me, to be honest, when I first started my job, to see what people in community groups actually do for very little money. So that's another side.
Yeah, no, it's so useful to get a sort of sense of all the sort of challenges. There's a lot of challenges and a lot of kind of a lot of things that people on this call might have ideas about, or, you know, or know somebody who has ideas about. So I guess there's people also tuning into this recorded. We put out a newsletter. So what you can do is, if you put a little bit of blurb together that sort of says what you're interested in, what you're exploring, and what your own sort of ideas or contact about, and then you could put your email address in there. And then if anybody's watching this and thinking, oh, you know, Rachel should try this, or there's this great person doing that, or you know, any sort of,
I mean, there's even things like, you know, people from the local community who might want to volunteer in one of these clubs but doesn't know that they need volunteers.
Yeah.
You know, there's a lunch club on Nightingale Estate, Nightingale Luncheon Club, and the staff that work there are very dedicated, but I would say, I'm sure they wouldn't mind me saying, they're not very good at saying that they need help or reaching out for local help. And actually, I would think that they would really benefit from that. You know, like a local person to Nightingale who just wants to spread the word about their club and is really more kind of outward thinking. So it's different, you know, it's different stuff like that. But I mean, I was up at Lunch Up, which was one of the clubs on Woodbury Down, on Tuesday, and I just had such a fantastic experience. I sat down with the members there. It's not an extremely well attended group, but there were about 6 men. It seems to attract men there. I mean, most lunch clubs are full of women, but this one, there were all these single men coming together. And I found it really touching to talk to them and to just experience what they, you know, it was a bit like I did a kind of on the spot working group. It wasn't meant to be like, you know, like when you ask questions, and I asked them, Charles, about, you know, would a map be useful, you know, because some of them were talking about, you know, transport, you know, and finding your club, how to find where you're going. All of those things that we don't often think about, you know. So I just did I really enjoyed it, because I'm normally at my desk, and yeah, it was a really, really good experience to just be there and ask these guys. But it takes time. It takes time in community work, I guess, to get to. Yeah, I've been in my job now for 3 years. It'll be 3 years this weekend. So yeah. But yes, thank you. Like being able to say what would be helpful is what. Yeah.
Great. And do come back, keep coming back and get the lunch clubs in as well. I've
invited them to this. Great. Like I said, I feel like I ask so much of them, and I do understand that, yeah, there's a lot that they don't always have the capacity to come.
Yeah. I'm just gonna need to round this bit off so we can have enough time to kind of pick your brains on the next bit. But Charlie, if you want to, come back, and then we'll move us on.
I was just going to say quickly that Rachel comes along to our Hackney Food Network regularly, which is once a month on the last Tuesday every month. And it's a similar kind of space to this, where we workshop some questions and we try and collaborate together, but specifically around the food poverty space. If you are working with any organizations that are delivering around food, they're very welcome to contact anyone in our team, and we can link you into that meeting as well.
Thanks, Charlie. So Charlie, could you get ready to share the visual note? I wanted to come along today to share some stuff that we have been working on, that this session has really helped us to evolve, but also all of the work that we've been doing really in the last 4 years, since the pandemic, working with frontline services from across the voluntary and community sector, but also across council and health services. We've developed lots of pilots. So some of them you may have heard of. Let me see. I want anybody who's been involved in any of these to put their hand up first of all. So there's the tools session you were all at. So I'll count that as a yes. So you've been involved in developing this in some ways. The council tax pilot. Who's been involved in the council tax pilot as part of the Fairer Ways of Working? I know that Jonathan has. I know that John has. Yeah, we go. Jonathan, John. So we've got, who is anybody on here involved in the Household Support Fund or the Trusted Referral Partners? Is anyone set up as a trusted referral partner to get crisis payments to residents who is on the call today? No, there'll be lots of people joining online. So there's that initiative. Has anyone been involved in the temporary accommodation, the work around improving health outcomes of children in temporary accommodation in the Woodbury Down area? I think Charlie's probably been in. Anyway, so we've worked on various projects, including around improving health outcomes for children and families in temporary accommodation, working alongside children's centres, Young Hackney, housing, and lots of voluntary sector partners. We've been working on a council tax pilot, which we can talk a bit more about. Maybe Jonathan and John can come in and we can just sort of tell you a bit about that afterwards. But all of these different pieces of work that we've been sort of piloting, I suppose we've been working in these ways because it's been really important to improve outcomes for residents and make things fairer, but we've also been using it to help us to understand what are the ways of working that help us to make things fairer for Hackney residents. And what we mean by that is, what are the behaviours and characteristics of our frontline workers across the system, but also our managers, our commissioners, our service designers. So this is not just about frontline, and this is not just about strategic, this is about all of it. Because what we've found and what we've learned over the last 4 years is that when we work in a different way, we get a different outcome. And if we are committed to working to improve, to really make things fairer for Hackney residents, recognising that things haven't always been fair in the past, and specific communities have missed out, there have been gaps, and this does exacerbate inequalities, we need to work differently. And I suppose we're on a learning journey with that as a council team who's really been just trying to learn from you and with you. And we've been trying to sort of make sense of what does that mean? What are the things across all these different bits of work, the ways that we work, that we think these pieces of work seem to have in common? When things work well, what are the things that people do that it might be different than the traditional ways that our services might work? And oftentimes it's sometimes the flip side of what we think it is. So first of all, I just want to share this with you and get some impressions. I'd love to hear from everyone on the call, if possible, on what comes up for you in your own work when you look at some of these values. This is a visual note that just has some of these visual representations of what we think we've learned. We had a little bit of funding from public health to help us to sort of pilot some of these approaches, and a tiny bit of non-recurrent investment in poverty reduction that have enabled these ways of working as well. And we used some of that money to get some consultants to help us to write this stuff up so we could share the learning and see whether some of these resources can be helpful to others across the system. So not just within the council, but across all of our services that are there to help residents. And when we shared some of these with some of our community infrastructure partners, who are a group of 24 charities that we fund to work with us as part on a sort of specific grants program that's been another pilot that's informed this work. What we found when they looked at this was, actually, we do this. This is how we work in our organisations. And what we're coming along and saying is that we're trying to learn how to work in these ways, because we're working within a council structure which doesn't always suggest that this is the way you get things done. But a lot of our colleagues out there in communities, a bit like what Rachel was saying, it's incredible what our grassroots community-based organisations are able to do, because they listen to communities and adapt according to what's needed. So I guess I just was interested if I mean, I can start to pick on people if nobody starts. I'll pick on some of my some people who I know won't get offended if no one wants to sort of chip straight in. But I guess what I'm interested in is, could you pick one of those things that you think, yes, I do that, or in my work, I'm trying to do that? Not to say you've got it perfect, because I don't think any of us have, but do these, sort of tell us a story about your work as it relates to one of these values. Give you a minute to take it.
I guess for me, oh, sorry, I didn't put my hand up.
That's all right, come on in.
I guess for me is sharing the knowledge and power. So from our health spot perspective, in sharing the information we've got and what we know are the common themes and what young people are coming through the front door with the voluntary sector, and I guess again them transferring us with those knowledges about what they're seeing, because at the end of the day they're the grassroots organisations that come across a lot of young people. So what are they seeing? What could we be doing, and what could they be doing better to offer a holistic health and wellbeing offer for young people, if that makes sense?
Yeah, it does. Brilliant example. Thanks, Aretha. I note that Rachel says it's too small to read. I wonder, are we able, Charlie, to put the link in to where it's stored on our drive so that it can be viewed? So there's viewing access for those on the call that might need to zoom in, because I don't think we can zoom in on the screen. Sorry about that, Rachel, with the size of the font, and I know the colour might be a bit challenging there. We'll see what we can do, and even if we just sort of email it across to anyone who needs it, directly emailed to have a look. Councillor Troughton.
I've just been able to make it bigger, so don't worry.
Fabulous. Okay, great. Yeah, see, find Zoom somewhere on your device. Councillor Troughton, do come
in. I find this really interesting, actually, and I'm very, very pleased to see that work like this is happening. Sometimes I, deal with residents whose problems are very complex, and very often, the council officers will say, well, we can help with this bit of the problem, but we can't help with that bit of the problem, and that there's just a gap in between, or something sometimes might fall between two services. And where, I think, we get a good outcome is where the officer uses their knowledge of, their own environment to sort of stretch the boundaries of what their job is, if you like, and what their particular role in the organisation is, and is prepared to contact a colleague in a different department, or research some open source information online because they've got some knowledge of it, but and really put themselves in the resident's shoes to sort of understand how frustrated the resident is, not being able to get this problem sorted out. It's very often people who are, I'm thinking of things like people who are leaseholders, for example. So, sometimes homeless people, their situation is they can't apply for statutory housing, you know, they don't fall into the criteria for the homelessness register. And, you know, or they're looking for transfers and things like that, you know. A bog standard response just isn't working for them for various reasons, you know, like if they want to transfer, no one wants to move onto their estate, you know, or they're in a housing association property and, you know, they're reliant on the housing association, but the council is dealing with, you know, another sort of aspect of their sort of issue. So it's really just being prepared to put yourself, I think, in the residents' shoes and, you know, be prepared just to stretch the boundaries a little bit sometimes. That's what really has helped.
Yeah, that's such a useful reflection and framing, Councillor Troughton, because I think one of the things is that this is really hard for council officers to work in these ways because of how and it's really hard for voluntary sector organisations. We're all constrained by different things, whether it's funding or whether it's what we're funded to deliver or what we have a statutory duty to do or the powers. And I think what you're talking to is actually about the human qualities of really, you know, of empathy and recognize and going above and beyond in spite of the system rather than because of it, because the system isn't saying that's what you're getting measured on and that's what you value, but you're going as a worker, you know, as somebody who cares about a resident and can see what predicament they're in, they are prepared to push boundaries and say, actually, yeah, that's not strictly in my role, but I'm going to do it because it's the right thing to do and because that person needs it. And because if I don't do that bit, we can't get to that bit. And I think that's what we always learn from these sessions is just how much work happens by really fantastic human beings doing, you know, in no matter which role they're in, whether they're the voluntary sector or the council or health or in a voluntary role or in any other service, that it's really about the things that people do and the ways that they think and the ways that they work within really difficult systems that make the difference for our residents. And that's what we hear time and again, I guess, from residents, but also from our services that are those who are kind of doing their best to support them in really difficult circumstances. So it's.
Can I also say that, you know, officers should never overestimate what residents understand about the systems. You know, many residents simply cannot navigate the systems. Many, you know, and a lot of them end up, you know, coming to our surgeries and just, you know, in absolutely desperate.
Yeah, and I think the other thing that I think that our colleagues in the voluntary sector and health and other colleagues have learned about this from this session is that council officers also, you should never underestimate how difficult it is for council officers to find this information, because even when you're in the system and you have access to all that, I can see Aretha nodding, you know, that it's not easy. And I think one of the things that comes out of this session is that some of our colleagues in the voluntary sector sort of imagine that it's easy for us, but it might be a little bit easier and we might have more power to get across boundaries internally, but it doesn't make it any easier to find the information. And a lot of the time we're just as in the dark. And in some ways that's been kind of a good leveler in this space, because often we sort of go, well, I don't know how to get hold of that department and I don't know either, you know, and it could be the council or the voluntary sector. So I think it's a shared issue, isn't it? Rachel, did you want to come in?
Yeah, I find this conversation very interesting because I think also there's something in there about building trust starts with being human. And I sometimes wonder if I'm too open, right? I'm quite an open person, and I, you know, if I'm struggling or if I don't know something, I will say I don't know. And that hasn't always been easy to do. And I have found for myself, I mean, I actually used to work for Hackney Council years ago, so I've been on the other side. But I do feel sometimes like there's a feeling where it would be helpful for maybe people to understand that within the council that you also, there are challenges and that you don't always know the answer, and being able to be more vulnerable could actually be helpful. But that's also my experience of living within a housing estate where people are very negative towards the council. I mean, we've got a WhatsApp group here and it feels like it's getting worse. They just go, oh, that's the council. And it feels like that's worse now than it's been before. And I'm just sharing that because that is something that I'm noticing, and I'm always trying to be the kind of balanced view, but our residents on the estate are just, and I'm often saying, well, they're people like us, you know, but yeah, often it's like people are hard to reach and all of that kind of thing. So I guess like showing more of the human side, so building trust. And the other thing I liked on there as well was professional language can be a barrier. I mean, I find professional language really difficult to navigate myself. And I think at first I always used to think I should know these things, and something wrong with me if I don't know what that means. And I feel more and more that if I just don't understand something, that I'll just say, I don't know what that is. And actually other people in the room didn't know, that they just didn't say. So I think if we can like just use less kind of, what are they called, acronyms and all of that stuff, it's helpful.
Yeah.
So yeah, I don't know, those are just like a couple of things, but I really like the way that this looks. And then I guess it's just, I mean, the other thing that I've noticed just in my own experience, but again that kind of comes back to personal, is that there's a kind of time that people from the council are available, and then there's a time when they're not available, and that's kind of like, it's not as flexible as it could be for like when other people, you know, often people work in the daytime and they can't attend meetings in the daytime, but often those are the only times that are offered. So it's like being, and we are, yeah, so just kind of being aware that you might be missing, you might be reaching the people that aren't working if you meet them in the day, but you're not reaching the people that are working. And just because you're working, it doesn't mean you don't have needs. And you know, you're not vulnerable. Just because you're in a job in the daytime doesn't mean that you might not need that support. So those just things that happen.
Really helpful. Thanks, Rachel. Batia, I saw your hand kept going up and down, up and down. You're having some technical. Really good to see you. Are you able to use your audio, Batia, or?
I think, can you hear me now?
Yes, I can.
Wow. I stuck one thing in the chat, which was recently, on behalf of a resident, I telephoned a department of the council, and they appropriately referred me on. So I rang the other department. The first thing they said was, well, go back and ring them. And that was really most unhelpful. It wasn't like they were ready to sort of say, which is our bit of the problem and which is their bit. And personally, I've had a run, which really, really is difficult for me I'm a wheelchair user. So I've had a run of council workmen and officers turning up without an appointment. Now, I don't understand why it is appropriate for them just to roll up and knock on my door when, you know, they don't know whether I have a PA with me, I don't have a PA, I have a carer, whether I'm dressed or not, whether I'm there. It seems to be a pattern over the last about 2-3 months, and it's really giving me the pip.
Oh, I'm so sorry to hear that. I know, I know, Charlie, I was just thinking it might be something that Charlie can have a look at and feed back and sort of try and understand better and get back to you on. I don't know if that's what you were going to say, Charlie. I know he has friends in those places.
Well, yeah, once in housing, always in housing. Actually, if you email me, so they're depending on the kind of the rights, depending on the context of these visits, it sounds like they haven't been considerate about how they've approached you, which is not what we should be driving for as an organisation. If you can give me some more context, then I can have a chat about who I think it would be really helpful to flag this to, because this is exactly the kind of thing I know lots of services are trying to avoid doing and trying to build systems to avoid, but obviously we're not there yet. So anything you can tell me would be really helpful. I know you've got my email, haven't you? So just send anything across.
Yeah, got your email.
Brilliant. So can I put John Davis and Jonathan Lang on the spot, since nobody else has jumped in straight away, just to sort of share any reflections that you feel able to at this point about how this council tax pilot, and maybe I should give a very brief potted background to it, which started incidentally through these sessions and through the willingness of our head of revenues and benefits to try something different. And we're sort of toward the end of this pilot, this council tax pilot. And I think I'd be interested to hear from Jonathan and John, I guess, whether, how many of these, what your experience was, I suppose, of the council tax pilot, and how many of these things on this resonate with that experience and what you learned through that work. While you're thinking about that, I'll give, is that all right, John and Jonathan? Are you able to talk, Jonathan? I know some people sometimes are multitasking whilst they're listening, so I don't want to assume that you can.
I was, yeah.
Yeah.
I heard my name.
All right, and I'm bringing them in because I went to a fantastic meeting this morning, which just left me really buzzing, hearing about the amazing work that this team of colleagues from across the system have achieved in a really short space of time. By working in some of these ways, we think. And I guess I'm interested to hear from sort of Jonathan, does this capture some of what was learned? Because I think that's some of the stuff that I heard this morning. But going back, I'll rewind a little bit for those who don't know anything about what I'm talking about. So some months ago, our head of revenue and benefits had been coming to this session for quite some time, Neil Clark, and had been coming away from the session thinking, actually, our voluntary sector colleagues and frontline workforce across this system are doing amazing work with the residents who don't reply to our letters. And we're chasing loads of council tax, and we're chasing council tax from people who we don't even know what's going on in their lives. And they were really struck by hearing from some of our food partners who were sort of talking about, actually, the people you're chasing for council tax are the very same people who have got a really, got really complex things going on, like Rachel was talking about, and that actually, they might have really serious mental health challenges and family things that where when they get that letter, it just sends them, they can't manage it, and they can't. And then the last thing they're going to do when they get that letter is to contact the council. So Neil, I'm sure, won't mind me saying that he came away from this thinking, crikey, maybe there's more we can do if we work in a different way with the voluntary sector, because so many residents who owe us money don't trust us. We've had a cyber attack. They may have had really difficult experiences, as some of you have talked about before. And it does lead people to feel like, actually, I'm not going to get in touch with them. They're not going to be helpful. And actually, I can't get on top of this. It's all too much. I'm just going to put my head in the sand. And of course, we all know that is not going to lead anywhere that's going to be that helpful for the resident, because in the end, the council may have to take action to be able to recover those funds. That might then jeopardize that person's tenancy, and then that, and then that's going to be worse for everybody. The council doesn't get its money back, but neither does the resident get anything that they need. So I suppose we were sort of working on that shared problem together. We had we came to this session, and Neil came and said, look, I want to do something different. I want to make this fairer for Hackney residents. We need to get the money back because we've got to pay for essential services. We can't not get this money back, because we do need to, actually invest in this. We've got big gaps in our, budgets, and we need to deliver good services. So Neil was up for trying something different, and Neil's colleagues, including Jonathan and others from the council, but also some volunteers from this group, from the voluntary sector, said, yeah, I want to get involved in that. I'm really sick of how we how the council chase debt, and we've been trying to help residents to get out of these situations, and it's really hard. So we'd love to be a part of the solution. So I suppose that sets the tone of how we started, John. So maybe I should hand to you briefly, and then you and Jonathan can kind of come in and share some of that experience, because I'm sure those on the call would love to hear about it. And just to say, we've been writing up some of these case studies that will be things that can go alongside this. So this is a sort of visual note with some of the ways of working that we've teased out. This is our sort of learning so far, but we've got a case study about the tools for frontline staff, which, we think this session is a really good example of ways of working that can help make things fairer. Hopefully you agree, because you're all here and you're all working together. And then there's another one. We've got various different pilots that we've written up in this way, but we'd also love to write yours up, Aretha, your Super Youth Hub piece of work, or we'd love to write up what you all do, lunch clubs. There's no reason why we couldn't build on some of these examples. And that's why I'm asking, I suppose we don't think this is the way that we work. What we're trying to say is this is the sorts of ways of working we've seen in the sector and elsewhere that really work and help make things fairer. So we want to celebrate all the brilliant work you all do, because it's not about us. It's really about recognizing what the common features are and how we can do more of it together. Great. But yes, so this is another example, the Household Support Fund and the Trusted Referral Partner route and co-location. So we've got some case studies there, which we will we'll be keeping on coming back to this meeting to develop further with you. So this was just a sort of starting point to sort of introduce some of them and spark a conversation, which we'd love to continue in all the different forums. And we're going to work out how best to use these to support everything that you're doing. But over to John to tell us, pick up where we. So Neil was up for doing something. We had some voluntary sector partners up for doing stuff. What happened next?
Thanks, Jenny. Like Jenny said, it sort of came out of these sessions, and we basically just put a call out to people who've been on these sessions and other voluntary sector partners that are in some of our other networks to see who wanted to be involved. I guess my main reflection overall is that it's just been really great to see the relationships develop between our council colleagues and the voluntary sector partners who've been taking part. I think probably fair to say there's probably, because of some of the sort of not understanding each other's roles and voluntary sector not perhaps understanding the challenges that the council faces and vice versa, it was just really good to have very open, honest discussions at the beginning about what the work was there for, the sort of work that people do, why they wanted to be involved, and have that really quite open and honest and frank discussion at the beginning, but then use that to build some joint aims that sort of carried us through the project. I think, Rachel, you mentioned earlier that we should never overestimate how much residents and people actually understand about the council's processes and how things like council tax work. And I think that was one of the early sort of reflections from our workshops that we did, was really, I guess, Neil, or maybe Jonathan, you can chip in as Jonathan as well, sort of really getting to understand that while our voluntary sector partners do amazing work, they aren't always equipped by the council with all of the information they need to really support residents. So a lot of it has been about building that knowledge and equipping them with the tools they need to support their residents, really. So we basically ran, I don't know how many, probably 5 or 6 workshops really with everyone involved, and it was about co-producing. First it was about understanding what the need is really amongst residents, what would be most helpful, and then co-producing together some outputs really. So one of which was some training which took place last week, which we had about 17 voluntary sector partners come along and receive some really great training around council tax and the support available, and lots of time for Q&A. And I think on that visual note, it says something around, where you end up might not be where you start. And I think that was like a really important part of the process, which is basically, although Neil and us at the council had some ideas about what we might want to do, it was still a very open discussion, and we sort of were able to come up with those solutions together. So it was very much a joint effort, a team effort between the council and our partners. And I think over the last few months I've been working on it, there is like a real sense of like team spirit and togetherness between everyone who's been involved, which I think has come through when we've engaged with people through things like the training as well. So I think it's been a really positive experience, and we want to move. One of the things that's come up a lot from our partners is that, and I'm sure this will resonate with people on the call, is that there needs to be sort of a quicker, more effective way of raising inquiries and when cases are particularly complicated. So we do want to use these relationships and use this work to actually produce some real tangible impacts as well, that can kind of be, I don't want to say measured, but that we can really point to as like a tangible output out of this work as well. So I think it's fantastic to build those relationships, but we want to make sure that there's like a long-term helpful impact for voluntary sector partners and residents as well. So I'm going to stop there, and I don't know if Jonathan, your mic is working again, but feel free to come in if it is.
And even if it isn't, if you want to type, we can try and do your voice, Jonathan. I've got quite deep.
It is working. It has been really, really interesting. I've been involved in, I don't know whether, I can't remember now whether the council tax pilot, that call it that, but I've been involved in 3 separate projects, all looking at different angles of this. And so there is this voluntary sector training because we wanted to provide extra knowledge to the voluntary sector so that they knew, as John said, the support that's available. They might not have been aware, for example, that customers can make a special arrangement for payment on their arrears. They might have thought that they have to pay it all in one go, that sort of thing. And we were just giving that information out there. That's just one small example. I'm also involved in council tax service transformation. So this is looking at improving the customer experience, speeding up processes, reducing error, all of the sorts of things that cause people to contact us and contact us again because something hasn't been done right, that sort of thing. I'm also involved in a project looking at a single view of debt. So that would be focusing on people who have debts in multiple areas. So they may owe rent, council tax, social care, and sundry debts, all sorts, and how we can help deal with those customers in a holistic way, talking about their whole debt and not all siloed, doing our own separate arrangement. And then what happens in that case is people end up robbing Peter to pay Paul instead of having an affordable arrangement that covers everything. So we're investigating that as well. So there's a whole host of things going on, and they will have incremental changes to the system, so that customers won't necessarily see a difference straight away, but over a period of time, I think will make a real difference. I mean, there's one particular thing that will make a big difference in the speed of dealing with correspondence. Now, vast majority of our correspondence comes in through online forms, and we're having a new system. It's already been purchased and it's being set up so that information that's put on the forms gets automatically put into the council tax system and updates it automatically. So there's no human involvement, there's no human error. It would only work on the basis of the information that's been put in on these forms. So that will remove I can't remember what the figures are, but it could be 60-70% of the correspondence work would be done automatically by the computer, in effect. Leaving staff to work on the harder things, the more complex things, in a better way. So that's the idea that we should be getting to.
Yeah, no, and I think it'd be brilliant. It'd be brilliant to kind of hear about all those in a bit more of a deep dive, actually, all about those separate pieces of work at a future meeting, if you were up for kind of, hearing a bit more about those, if it was appropriate. I guess I'd be really curious, Jonathan, given that you worked across these 3 projects, thinking about the projects that you and John have been working on with the voluntary sector group. We've pulled out these behaviours, adapt how you work as new challenges and opportunities arise, and we've pulled out get together often and in council buildings. But I wondered if any others might have stood out to you when you saw that visual note. Charlie, would you mind taking it back to the visual note, just the behaviours? I was just wondering whether anything, do any of these kind of spark anything for you about your experience of how it was working with the voluntary sector groups and with the council tax pilot that was sort of part of the fairer ways of working?
Well, all 3 really, to be honest. The whole, the whole thing is trying to put people first, so that we are thinking about a resident's whole, perhaps not their whole life, but learning about the resident and taking each case on its own merits. ensuring that we are offering what support is available, and then we were sharing, as I said, sharing knowledge with the voluntary sector, and many of these, in fact, none of those that attended the training knew about the government breathing space scheme, which allows a debt respite scheme is what it's called officially. It's 60 days when no debt recovery can take place while somebody is getting debt advice and trying to come up with a way of getting out of their problem debt. And that extends to a mental health breathing space, which doesn't have a time limit whilst somebody's under receiving crisis treatment. And none of them knew about it at all, which I was really surprised about. So, wow. Whereas every debt advice charity has been trained on this, or should have been trained on this by the insolvency service, so obviously part of the government. So, and I thought that would have disseminated down to these other groups, and it just hasn't. It's at that point. So
it's like Rachel said, we can't underestimate, people don't know this stuff, and sometimes our training doesn't get to where we want it to for whatever reason, doesn't it? So it's
So I actually put that particular slide into the presentation on purpose because I wanted to make sure everyone knew about it. I had no idea that actually nobody knew about it. So I was really pleased that would work, and it might be that requires going into deeper as well in future time.
Brilliant.
Just thinking about that last one, we've got adapt and learn. We've certainly learned about the way to provide training to people that aren't council officers, that have been council officers for a million years, like I have.
Yeah.
Because the original slide deck that we had for that was so dry, so much content, so long. It's probably the sort of thing that I would have put together, actually.
Okay. Our typical council slide deck. Sorry, Jonathan.
We recognised that it wasn't the right thing to present to the voluntary sector, and because we worked with them, because we had two people from the voluntary sector with us, they actually helped turn it into a very good presentation, which everyone seemed to rave about at the end. That was quite very rewarding. That was, and that what we've learned from that will be taken forward for sure.
Yeah. And in terms of what it costs to work that differently, it didn't cost much, did it? I mean, I think we paid for the time of the voluntary sector organisations that were involved in developing it. But aside from that, it was giving up time, which is obviously worth a lot in your busy services. And it was a space, really, wasn't it? It hasn't cost loads of money to do that way of working or that training. It's been sort of enabling people to get involved, really, and give up time to build relationships and work together, isn't it? And share knowledge. Thanks so much, Jonathan. That's really helpful. Charlie, if you wouldn't mind just taking it down now, so I can see people's faces just before the end. I guess really keen to hear other people's reflections on this stuff, because this is really just a starting point. These are some, ways that we've sort of pulled together the learning so far from all these different pieces of work. And I guess just really interested in ideas that this sparks about the way that this stuff could be helpful for all of your services and the things that you're doing. And did anybody sort of have something that they wanted to share before we round up? We will be coming back and we will tell you more stories about what's been learnt so far, but we also want to hear your stories about the ways that you've been working that have been really in line with this, or anything that we're missing, so we can continue to sort of develop this work. Great. Okay. I don't know who is next. No, Rachel, then Batia, then.
It's very quick, but I've heard that, I think it's from your team, Jenny, but I've had a request to set up some team meetings in lunch clubs for somebody's team. And I think it's brilliant. It's a way to come and have your team meeting in a community group and then have lunch afterwards. And it means that, because often the feedback I get is that, why aren't people from the council coming and meeting us and telling thanking us for what we're doing, basically. And I just think, yeah, that's just a simple way of like meeting and seeing human faces, you know. So that was, I think that's a thumbs up from me. And I'll do all my best to make that happen as well.
Oh, I love that. So if anyone is working in a team where they'd like to come along to one of Rachel's, one of the lunch clubs, there's a real diverse network of them, then Charlie can help connect you into Rachel. Rachel's email will be on. But yeah, it's a brilliant idea. I've had so much from conversations with residents in a food bank or a lunch club. There's, you know, much more than research and doing.
I think so. You just get to meet regular people, and they are very, you know, people. Yeah, it's good.
Brilliant, thank you, Batia.
There, did it. I just wanted to come back on the debt holiday schemes. I did find out about them, but then I actually didn't manage to do it. It was incredibly complicated to find an agency that was registered to do the debt holidays and also had a space to take on somebody within a reasonable part of time, given that if a client has mental health difficulties or huge stress, or they're a carer, they're asking voluntary organizations to help them, and most of us don't have that equipment. And if we can't get a response within a fairly quick time frame, then the service user is going to sink without a trace.
That's really helpful. I'm wondering, Batia, I know we always ask you to put these bits of insight, that you always share such important insight to help feed back into these programs, because as you've heard from Jonathan, there is, you know, the council do acknowledge that there's problems with these things, and you're trying to do something. There's lots of different pieces of work that looking at what improvements are needed. So that insight is really useful. If you could drop that in an email to one of us in the team, we'll be sure to get it to, I mean, Jonathan's got his email there and everything as well, but we'll be sure to try and get it to the right person, and have some kind of response about what's being done, or where you know, where you might be able to start, because otherwise we'll get into the detail of it now. Is that all right, Batia?
Yeah, that's fine. I mean, I think it's more about saying, to be aware that, you know, we're the grassroots, and where we need to refer up, we actually need more information about the pathways, and we also need organisations to understand that sometimes by the time people come to us, it's actually last minute desperate. And what we don't need is to be, you know, told, well, now they must go and do this, and now they must go and do that, and they're digitally excluded, and you know, you just feel like you've let them down because you can't actually get them through that pathway.
Absolutely. Yeah, I can see Jonathan's head whirring there. It's been heard, it's been logged, he's noting it down. Councillor Troughton.
Hi there. I sort of wonder why I'm the only councillor that comes to these sort of meetings. And I think there are councillors, I'm not, you know, I don't think it's universally the case, but there are councillors who would be able to do some more of this kind of more advisory kind of work. I mean, you know, I hold surgeries, like I hold a surgery once a week in the Pedro Club, and I do anything from council stuff to HMRC stuff, you know, I mean, whatever insurance and whatever the resident brings, I will deal with it. And there are councillors like me who have got enough experience in that sort of like line of work to be able to, you know, do more sort of like on the front line, you know, to actually, rather than having to keep coming to the council to do it, you know, there are things that we could actually do ourselves. I just wonder, you know, what engagement there's been, you know, with the political groups, you know, to enable them to do that.
Yeah, no, it's a really good point. And I guess we'd be really interested in any ideas you have about how we can make that easier. We certainly have invited all the councillors, and the poverty reduction councillors, sort of lead councillors for poverty reduction, are really aware and have really supported these sessions and have come to some of them. I know that Councillor Kennedy came in person to the Tools Live session, and so and that Councillor Walker is also aware of them. But but again, we know how busy everybody is, and it can be quite difficult to know which of these meetings to prioritise. So the more the kind of word of mouth that, if you were with councillor colleagues, Councillor Troutman could say, and we're able to prompt people, or even if people wanted to have a chat, if they were, ahead of coming, to understand what it is. But I suppose we'd usually suggest that people watch one and then they know what to expect. So if they watch a recording, then they can go, okay, that's what I, because I think sometimes as a councillor, they might think that their role is to do something that's a bit more expert, or just like sometimes, that we're all participants in this, that nobody's, that this is really all about working together. So everyone's here focusing on what residents need, rather than coming here to try and sort of, obviously we're promoting the services that are out there, but with the purpose of supporting residents rather than anything else. So I think that's be great to, and of course getting insight from the group about what's not working. I think that's really key. But I know we've got 1 minute over time.
I'm not so much thinking of attending these. I'm thinking more along picking out things that councillors could actually address, while they've got the resident in the room.
Right, as in terms of their resident facing role, in terms of
exactly. Yeah, okay. and then providing a sort of training package on that. It might be long term,
that's a great idea.
It's not going to be everyone that can do it, but there are definitely some who would want to, and could do it.
So it's about enhancing their ability to support residents by having this whole team behind them. Yeah, brilliant. We'd love to pick that up with you. Maybe in a separate conversation.
I'll speak to Councillor Walker about it.
Fantastic. Yeah, we'd love to think about how we can do to support with that. That sounds like a brilliant idea. We have gone over time, so before I'm happy to stay on for a few minutes so we can hear from the 3 people who've raised their hands, but I'm also really conscious that we have gone over time. It's an hour and a half and it's a long day. So do you want to just, okay, hands have gone down with that in mind, but let's come back to this. Also email, please don't lose any of your ideas. Email one of us, email John or Charlie or me. I'm sure you've got one of our email addresses, and just let us know. And Chanel and Maddie, we're all thinking about this stuff, and so any ideas are really welcome. I'll let brilliant. So Rachel was supporting your idea. There was lots of support for that idea, so we'll definitely follow up on that. Charlie, last word, and then maybe then John, very quickly, what's on next time we meet in 2 weeks? Charlie.
Just my usual shtick. We are working with lots of energy providers to get energy advice across the borough. I put in a little blurb in the chat. Marcella's got access to some energy vouchers if you're really struggling. For residents, they need to be Hackney housing, but talk to us. And if you want an energy advisor to come to any of your sessions, let me know. We're booking up until the end of June.
Brilliant. Thank you, Charlie. John?
So 2 weeks time, we have got Eva from Hackney Caribbean Elderly Organisation is going to come along, but we have space on the agenda as well. So if anyone wants to talk or share anything, then just let me know.
Great. And if not, we'll do more talking about some of these ways of working, and so we can tease out some more of your brilliant examples of all that incredible work you're doing. So thank you so much, everyone. I know that I'd love to hear it from Mimi as well on the ways of working things next time. It's great to see you. And of course, Joycelyn, National Parents Forum, one of our community and one of our organisations who's helped develop this. So yeah, thank you all so much.
Okay.
And yeah, well done on all the brilliant work so far.
Thanks, everyone.
Thank you.
Bye.
Bye.
Thank you.
Thanks so much.
Bye.
Oh, lovely to see you, Joyce.
Thank you very much.
Thanks for saying. Great. I'm glad. Oh, brilliant. Bye, everyone.